When you think about the per capita demands of somebody who is 65 on the healthcare system versus somebody who's 25, they're very, very different. All of a sudden you're starting to need hip replacements and other things. The healthcare system today is not geared to all of a sudden see 40 to 50 million baby boomers demanding 40 to 50% more healthcare at a time period when there has been tremendous amount of pressure on the healthcare costs. We are really going to see a tremendous amount of stress on the healthcare system, and that's going to manifest itself in the fact that we think there could be a doctor shortage, into the tunes of tens of thousands of doctors short of what we need to continue delivering healthcare the way it is today.
So at the moment, the way healthcare is given in this country is largely at the hands of your physician or in the setting of a sophisticated, complex, and sometimes even unfriendly hospital environment. I think we can do better, and we can do better by providing actionable information to patients and families about the conditions that they or their loved ones have in light of the therapeutic opportunities that may be available to them. And so one can imagine not having to go one place to get a diagnostic test, another place to get a prescription, a third place to get the particular therapeutic doled out or implanted in the case of complex medical devices. But one can start to imagine systems which are present either on or in your body that will let you know about your disease activity and inform you about how to modulate the therapy that you already have. And so this is perhaps the notion that chronic conditions require continuous care, not episodic and expensive care.
Ultimately, we think we have an opportunity to create infrastructure-independent healthcare. And what does that mean? And it's really something that I know I'm excited about. It's like, how do we take these remote sensors, how do we take wireless delivery technology, how do we combine that with algorithms and the internet in such a way that we can deliver the right treatment at the right time for people where they are, and not necessarily have to move people into a centralized location like a hospital, but how do we deliver healthcare where they are when they need it?
So you can imagine the notion of healthy home. You can imagine having your home as a place where you get medical care. You can imagine being empowered so that you as an individual can take more responsibility for your health care when armed with the appropriate information, not just about how your disease is managed, but how your disease is active in you. I think we have a bold mission, empowered by a remarkable set of resources. Both the people and the financial resources available to us are going to allow us to, for the first time, propose and accelerate infrastructure-independent care.
We're going to be able to create remote monitoring, remote diagnosis, and we're going to be able to also, more importantly, take that and put it in a form that's going to enable a caregiver or the patient themselves to take action that will allow us to, again, avoid things like the hospital. So infrastructure independent, to me, boils down to three big ideas. It's the right treatment at the right time where people are.
Physicians adopting new therapies, new technologies, is often written about as a remarkably challenging problem. The Institute of Medicine has described that it can take as many as 16 or 17 years to go from first demonstration of value to final stages of adoption. We can do better than that. We can do better than that because we're leveraging off of certain societal imperatives at the moment. We desperately need to lower the infrastructure costs of healthcare. We desperately need to respond to patients as they wish to become more involved in their own care. And so providing the tools that are currently in demand to solve those two very substantial imperatives, I think will make it easier because we'll be finding a natural niche. We're not forcing people to do something different. We're instead solving problems that they've already identified. Gary and Mary have been prescient in their understanding of where the economic needs of the country are with respect to healthcare, and that's colliding wonderfully with what the individual patient wants in terms of healthcare at the moment. And so that intersection of something that we all need and something that each individual wants, I think is going to be irresistible.